Hello friends, let us understand more about analysis of similar event. You might have come across this term analysis of similar event. Aose or ASIME. So what exactly is this and where it is required? So analysis of similar events are generally required when there is open IND and the clinical trial cases when it is a SUSAR, that is suspected unexpected serious adverse reaction, where sponsor causality is related. Then as per 21 CFR 312.32, we need to provide an analysis of previously submitted IND safety report considering the current safety report. So what exactly you will look forward for? So for analysis of similar event, you look forward for the current event, its correlation, and the same or similar cases which are previously submitted as an IND. When you look forward for same similar event, those are like same similar PTs, and you may also explore about the SMQs, standardized Medra queries, or HLGTs or HLTs. When looking forward to us, like how would you like to filter out the analysis, the cases which are required for the preparation of ASIM. So generally there is a cutoff date when you look forward. Most of the time it is IRD or LRD of the SUSAR case. So IRD or LRD best based on the date when it turns out to be a SUSAR. With that cutoff date, the listings are pulled from the safety database, and those based on those listing, analysis is performed. When you are working on like phase one or phase 2 studies, the number of cases would be considerably less. In those scenario, you may come across 3 or 4 cases having the same or similar PTs or like in a SMQ search or in HLGT. Ideally, in those scenarios, each case is actually summarized briefly, and then those are like explained, and then you also look forward for whether the current case has any impact on the benefit, any impact on the risk profile. Benefit risk profile definitely, but mostly the risk profile of the drug. If it has any impact on the risk profile, then you may look forward for whether you need to update any ICF or like any inclusion exclusion criteria of the protocol or the conduct of the study, those. So you start with on this date safety database was search for these PTs or SMQ or HLT considering the event of your current event, and then you will say that based on the search you got no similar cases. Sometimes it is possible that you won't get the similar cases also, or you may come across the number of cases. Then you have to explain those cases one, two, three, four, and if it is like the count is more, then you can do a collective analysis and explain like there were 14 cases present in the safety database. Among those 14, these were from the phase 1, these were about the phase 2 trials. How many males or the females were exposed? Based on the latency you can explain. Based on the outcome of the event, some of them might be life threatening or fatal, and other with other seriousness criteria. And you say that the risk impact, whether it has any risk impact, and subsequently you will monitor the cases coming forth, because it is not like that you have received this, you may come across the essays where causality is unrelated, but you will get number of cases. So you will monitor those cases also, and if you have any trend coming from any preclinical study suggestive of this similar event, you can mention that. So overall ASIM is written in this format. I hope you it will help you to understand more about analysis of similar event. Apart from that, you if you refer the Health Canada where life threatening and the fatal cases, even though the investigator causality is related and sponsor is not related, vice versa, analysis of similar event is expected, which is written in the similar way considering the cases. So thank you very much. Please share this information with those who really need or looking forward to learn. Thank you.